Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great mobilization exercise for the neck for those of you with cervical degenerative, herniated, and bulging discs. Hope you enjoy. So many times, chronic neck problems, especially cervical degenerative disc disease, herniated discs, bulging discs, can be helped as a self-management skill with mobilization. Mobilization means not necessarily stretching, but moving the joints in the neck, moving the disc fibers, the muscles, the ligaments. The more frequently we move it in a pain-free range of motion, it helps to improve circulation, it helps to break up scar tissue, helps to mobilize joints, nourishing cartilage and disc fibers through motion. So to go through it, you first need to know what your RPI is, reverse posture isometric, and how to set a neutral spine for your body. If you have a tendency to lean your head to one side, rotate it, perhaps round a shoulder or a tip a shoulder posture, elevate a shoulder posture, you know you have to correct these things by first going through an analysis on your body. So if you haven't yet done so, check out our painfreeandfit.com website. We've got a free body analysis there to get you started and starting to understand what postural or muscle imbalance or movement error tendencies that you have that can be imparting mechanical stresses to your neck and aggravating things. Once that's set, we're going to go through the following mobilizations, respecting our neutral spine and RPI, avoiding any motions that cause pain. The first mobilization is always done as a head retraction mobilization. By pulling the face straight back towards the back of the head, it corrects the typical forward head posture that many people have. Remember, you're going to make sure your shoulder blades are held in a neutral position, avoiding rounding, tipping, downward rotated, winging scapular positions, because those pull on the muscles of the neck that attach to the shoulder blade. As we create this head retraction, we're going to maintain that as we go through a rotation to one side and another. Again, using a range of motion that feels comfortable. If you have a tendency to look more to the right than the left, and the left is stiffer, you'll probably want to spend a little bit more time holding that position or trying to increase that range of motion that's missing on that side. The typical tendency when you do this, of course, is for you to lose the head retraction, and the further you rotate, you start to anteriorly translate your head. What that does, it starts pinching the facet joints, the back of the disc, many times aggravating. So the further you rotate, make sure the more you have your head pulling back within a comfortable range of motion. Second mobilization as we maintain that head retraction is a lateral flexion, which is a side bending. If you notice the way I'm doing that, I'm avoiding just crunching down, which many times aggravates disc and joint problems on one side. I'm using more of a up and over motion, whereas I pull the head back, I'm moving up and over like the top of an arc. Again, going with a range of motion that feels comfortable. If I have a natural tendency to tilt my head to one side, I'm going to emphasize the range of motion, obviously tilting to the other side. And I can go through these repetitions anywhere from 10 to 50 repetitions. I can also use an extension range of motion, which is a backwards bending. If you've seen any of our other videos on the channel, you know that many times chronic neck problems, especially disc degeneration, herniation, and bulging at C4-5, C5-6, C6-7, has a loss of extension or backwards bending at the base of the neck, because most people with those problems have a tendency to bend or extend from the upper neck, the upper cervical spine, where the skull rotates more than the neck actually bends back. So you can affect this in a positive way by pulling the head back and moving backwards, letting the bottom of the neck move back as opposed to the skull looking up. And that's a mobilization, again, that can be done within a pain-free range of motion. Using these three maneuvers, lateral flexion, rotation, and extension, multiple times a day, even as little as twice a day, for 10 to 50 repetitions. The more repetitions you do, typically the better relief you're going to have. Has a tendency to increase circulation, break up scar tissue, as I said, and get those joints and disc fibers moving again, many times stimulating afferent nerves, which are picking up motion, helping to dampen the pain effect of nerve supply coming in from damaged and irritated tissue. Plug this one into your repertoire and see if it helps. Again, if you're looking for a great program to try to tailor fit your rehab to what your postural movement and stability needs are of your neck pain, check out our Healing Neck Exercise program at painfreeandfit.com. It has a full body analysis related to your neck pain and all the custom stages you need to develop a unique, tailored program for your neck pain through stretching, rehab, strengthening exercises, movement pattern, coordination exercises, and we even talk about nutrition for inflammation. Check out our Pain-Free and Fit Neck Healing Program. It'll be an excellent resource to use in developing a unique program for yourself, customizing your neck rehab. Questions or comments, write in. As always, I'll do my best to answer them. Give me a thumbs up below to help share this valuable information with others. And I hope you've enjoyed this neck mobilization series for chronic cervical degenerative, herniated, and bulging discs.